Lou Gehrig's disease, and also known as ALS, is a nervous system disease that weakens muscles and impacts physical function. What is ALS? It is a disease that breaks down nerve cells, which reduces functionality in the muscles they supply. This cause is unknown. The main symptoms is muscle weakness. It is also inherited mutation in a dominant gene, meaning the person who only inherited it from the one parent to develop symptoms. New genetic mutations. People with sporadic ALS display spontaneous genetic mutation that cause their ALS, which are not hereditary. Lou Gehrig's disease, ALS, causes these motor neurons uh, to die, will eventually die over time. Muscular weakness, problems with coordinating, stiff muscles, loss of muscle, also muscle spasm, and overall reflexes. The whole body gets fatigued and feeling faint. Speech is difficulty and the vocal cord spasm. Also common difficulty swallowing, drooling, lack of resistance, mild congestive impairment, severe constipation, severe unintentional weight loss, and shortness of breath. Prognosis: most people die from being unable to breathe, like I said earlier. They usually within 3 to 5 years the first system appears. However, 10% survive a decade or more. The average person with ALS is 2 to 5 years, but like I said, they live longer. Age is associated with favorable survival rates. ALS is also a rare neurodegenerative disorder that affects upper and lower motor neurons. Symptoms can include muscle twitching, cramps, weakness, blurred speech, and difficulty swallowing. Some symptoms: the initial ALS can be quite varied. One person may have trouble grasping a pen and lifting a coffee cup, which is tripping, falling, hand weakness, clumsiness, blurred speech, thinking or behavioral changes, I should say, trouble walking, usually doing daily activities, often hands and feet, arms and legs. It spreads throughout the body, making the whole muscle nerve cells die eventually, so they have trouble chewing, swallowing, speaking, and breathing. Diagnosis through examination, often ruling out disease that mimic ALS. Such tests as a spinal tap, x-rays, MRI, melangiogram through the cerebral spine, and a muscle and nerve biopsy. Treatment can't be reversible, unfortunately, but they can also slow the prognosis of symptoms. They can also help prevent complications and make you comfortable and independent. You might need a team of healthcare providers that have been trained in this. There's also medications by the Food Administrative Drug that do help treat ALS, which is thankfully a good thing. You can get the medications, but they do have side effects. The two medications is one of the medication Riluzole taken my mouth as the medication increased the efficiency by 25%. Cause dizziness, gastro conditions, and liver. They also cause muscle cramps, constipation, fatigue, and that's excessive saliva and phlegm, leg swelling. Also, the ability, they help with the ability to breathe and speak and move. Like therapies and other good support can help. What also helps is breathing care with ALS, eventually more troubling breathing because the weakening of the esophagus. Your health care provider may help with breathing regularly. You might also choose a ventilator with a mask to help you breathe. Also, physical therapy is a good way, to keep trying to address the pain and to keep your walking and mobility. And also, speech therapy is a good way to just keep trying to cope with it and get through the ALS so you don't just deteriorate right away. But yeah, I hope this helps. And thank you